love music. And I started when I was in high school, and I just knew that was my destiny, music. For some reason, I just knew that. And I've been pursuing it ever since. I had prostate cancer. Well, when I had the CAT scans done, the CAT scan picked up the liver, that something was wrong. So I had 4 biopsies taken out of my liver. It came back that I had cancer the size of an orange on my liver. A doctor, he referred me to Dr. Fraiman. When I first met him, you know, I had my family with me because we're close.
When Tyrone came into the office, you know, there was an entourage following him.
4 of my children and my brother and sister. It was 6 of us total.
And I remember spending it seemed like, you know, over an hour just answering their questions, fielding their questions.
Oh, he talked to us just like we was one of his family. He just explained every detail, what was going to go on, how it was going to go on, what would be the consequences and everything. He just went over everything piece by piece. And that's why I admire that man, because a lot of them don't do that. They don't do that. And I just felt comfortable with him.
Once you win a family's trust and they truly believe that that you care about that patient and that their best interest is in your heart, it makes the ultimate goal of taking care of him so much easier.
He explained 2 options about the surgery. He said, it's pretty big. If we cut it out, if we cut the whole cancer out, then you're probably only going to have 35% of your liver left, and you will be sick. The second option was that he could go in and do two different surgeries. I would have at least 70% left. And if it worked out like it's supposed to work out, then I wouldn't have to do chemo.
With Tyrone Brooks, I decided to do a 2-stage procedure. And the first stage was to ligate or exclude the blood supply to the side where the tumor was. That increased the pressure on the side of the liver that was staying and allowed it to grow, and then we were able to do the surgery safely, with him not having any evidence of post-operative liver insufficiency or failure.
The whole staff was excellent to me. Every time I went through the door, they greeted me like I was family.
I believe from the moment that a patient calls and we pick up the phone, I think they're comforted. You know, we're actually a family there, entwined in each other's lives, and we know what it's like and we know how important it is to have a loved one that is ill, and we know that it's important for the patient to get in there and get the care that they need.
Debbie, she's something. She's just a miracle. She had treated me and my family so well. She's a wonderful person, Debbie. Yeah, I do. I love Debbie. And she's that way with everybody.
When a patient leaves our office, I want them to feel as though that we've put our arms around them, that we've comforted them, and we're going to put them in a really good place. We're going to take care of them.
And that makes you feel good when you go into a doctor's office. And you got people in his office that's that way. It just makes everything better. It was an experience, but it was a good experience because I knew in my mind that Dr. Fraiman had taken care of me. Like he told my family, he said, I'm gonna do what I gotta do, and I'll give you my word he's gonna be okay. And my family was overwhelmed by that because that's the way it turned out. After 1 month, I was back playing the saxophone again in church. I know what he did for me. He saved me. And I think he saved my life.
The Liver and Pancreas Center. Hope at the University of Maryland, St. Joseph Medical Center.